Well, we talked a little bit about some of the adverse events, some of the cytopenias that can occur, and the fact that that the antibody is really pretty well tolerated from an infusion standpoint. That's impressive in the setting that this therapy goes on, this combination therapy goes on for a year, and then patients can drop off of the lenalidomide and remain on the MOR 208. And John, based on other antibody approaches and R squared, which is probably the closest equivalent that we can come up with here. Is that how you would approach it? Do you think you would just continue on with the lenalidomide, or what do you think about that?
That's a great question. Certainly lenalidomide is, for most patients, relatively well tolerated, but not for everybody. There are certainly risks for deep venous thromboses. We don't see that often if we can kind of prophylax with aspirin use in the majority of patients. In general, though, what I would say is if people are doing well, it's a judgment call at the time that year is up. More importantly for me, I would say, is the continuing of the antibody treatment. And you could argue that all of this therapy, as long as you can possibly deliver it, is valuable for a patient who might not have other treatment options or may actually be significantly benefiting for long periods of time. I don't know the right answer there. I mean, I suspect you and I might see the same patient and approach it a little bit differently. For me, in general, I'm probably going to stop the lenalidomide at a year. I hope that I don't get burned with that. How about you? What are your thoughts?
Yeah, I think I probably would too, until, I think we need a little bit more details of the study still to come out in terms of what does the shape of the curves look like? Does there a sudden drop off at the point where you stop lenalidomide? If that did, then I might continue with it. On the other hand, and I guess if someone was tolerating it well, that might make you want to at least open up the option of continuing. Otherwise, I tend to do it just like they did in the clinical trial.
Yeah, I do too.